You want to come, and I want you to try this one.
Now, I remember something you said. You said don't forget to fill up here. I don't know what you call this part.
The axilla area.
The axilla area. The axilla. Okay, I don't know what you call it, but I know you said fill up here.
Okay.
Okay. All right. Feel something right here.
All right. So.
Next is the wedge. The wedge.
Okay, we're gonna. She's gonna just practice while you're doing the wedge.
The wedge make me think about the stars. You know, when you make a star, you go out like this. Or the sun. Sun rays. The sun rays go out. Go all around. Go out like that, and you feel it. Go out. All around.
Very good.
That's sun rays. Don't make me think about it. Mm-hmm. Go out. Okay. Sun rays. And also, it's just the nipples also. Okay. The sun rays. Make me think about it. Sun rays. All right, how did I do?
Very well. You did very well.
Thank you very much.
We have Miss Alicia here practicing on the other breast model. But we want to make sure, I feel something right here. We want to make sure we go deep enough. We go on a circular pattern using 2 fingertips. And then go around. One thing Mr. Ralph forgot to do is to squeeze the nipples to make sure that there's no pus or no drainage or any milk coming out. Don't squeeze them too hard.
Excuse me, let me do this so I can correct myself. All right, thank you for helping me out.
I think that's too hard.
Yeah, don't squeeze them too hard.
Oh, okay,
Miss Brenda has acknowledged that you don't want to squeeze too hard. You just want to just barely tap it. Okay. All right. Okay. Okay, so Miss Alicia is practicing. Have you felt anything?
I felt one over here.
Mm-hmm.
Is something in both of them?
I can't tell you that. You have to find them and identify those for yourself. Right. Don't push too hard. Yes, Miss Brenda?
Should she be using the powder on there?
Yes, we can use the powder because it'll make it a little bit easier for her and she won't have to push so hard on the breast.
That's what I was knowing.
Because breast is very sensitive tissue. You want to be very careful.
Now, is that just baby powder?
That's just baby powder.
Oh.
Okay. And then for women, I want you all to know that you want to perform this exam about 1 week after your menstrual cycle. And if you're menopausal, you want to perform it, just pick 1 day out of the month and just do it every month. Okay. So what we'll do now is we'll end the class so we can get ready for the skills checklist. We want you all to have the opportunity to practice, and we want you all to look over the handouts, and then I want you all to really focus on what that video, the Susan G. Coleman video, talked about. You're going to have a little quiz at the end on the ABCs of early detection, the 3 things we talked about as far as how to detect cancer early, and I'll review those with you: mammography, clinical breast exam, and self-breast examination. Those are the 3 things you want to remember. And then you want to be able to identify all the lumps in each breast because you got to get 8 out of 10 correct, at least 80%. If you don't get them all, we'll reteach you how to do it, and then we'll retest you. Are there any questions? Everybody understand what the responsibilities will be?
Yes, ma'am.
Okay.
Get up and look like you're doing something.
Okay. So one group will be working on
All right,
this,
we're going on this side.
and then the other group will be working
All right,
on
this is
this
we're going on
breast.
this. Here, quill it over here, David. We'll work down here.
Well,
We'll
honey,
work down
Alicia,
here.
you might have to get up and help me.
We're gonna sit right here.
Okay. And it's easy if you stand up and do the circular motion. The fingertips. Remember, you're only using fingertips. Don't poke holes in them with your fingernails because that can't happen. If you're in a group and you see your, group members,
Like, let me see. Like this.
you feel a lump.
Where?
You know, kind of like
Let me
that.
see.
Go around
Down
here.
That's part of the thing, Jeff. Here's the lump right here.
2
I'm gonna
fingers.
feel you like
Right there, feel it.
Okay, so
That's the lump.
help your
Where?
classmates if they
Oh,
can't
part
find
of the
right
blurs.
there. Feel a lump
This
right
one's
there.
hard. This one's hard to find them in.
Yeah.
I only found that one.
These
These are some good stuff.
Fill out.
Remember, it's about
you know
don't
where
push
they
it too
are,
hard. Just use
I only
your
found
fingertips 'cause
one.
you
How
can
many have you?
It's about 8 to 10
In
lots
this-
in
in
each.
this
One right here.
Not in
That's
each
the
breast
No, it's
necessarily.
not right here.
They might
Oh,
be
man.
grouped together.
There's another one right there.
So there's two. Let me feel.
We found two.
Oh yeah, there's two.
One right here.
Some of
You
them
found
might.
a lot.
Man.
I mean, this is
One
tough.
right
We can't feel nothing.
Keep one right there.
Can you demonstrate again which
I
fingers
feel one
you?
right there.
That one right there.
I use these two fingertips.
And what's the other one? The rub down?
the up and down,
Up and down.
vertical, and then the circular, and the wedges you go out.
Nothing there.
Like Mr. Ralph
I don't
said,
feel nothing in
remind
this
you of
one.
the sun.
Oh
Like using the powder and make it easier, maybe to slide your hands on the breast.
Let's have a look
Did
at
you
it.
make that up, sir,
No, I mean,
Or did
think
you-
about it. I mean, some days.
or did you just read it? Did you read that?
I like some days as well.
He was listening to the lecture on making
Susan
sure you
B.
use the
Cole.
powder. It makes it
At least
easier
that's a
to
lot of
find
powder.
lumps.
Well, we can't find any in this one.
Where are they in
Can
this
you help
one?
us, Miss French? Because we're having trouble with this one,
Okay.
and we've used the circular motion and everything.
I feel
Okay.
one right here. I feel one right here. This
We can't find nothing in
There's one right
this
here.
one.
feel right here.
Okay, it might not be
Go right
anything.
there.
If you're doing
Go
it
right here.
properly, you might
Go
not
right here.
find
Yeah,
anything in
there,
one
there,
breast.
there, and there.
But you want to make sure that you make sure
Now,
you
this-
cover
You
all
can't see
Yes,
bases.
me filling any in that one. We
What
can't
about
find
under your arm? You
Yes,
said.
I make sure you check the
it.
axilla area.
Let's try there.
There's a hard.
What do you
You
call
found
it?
one in the axilla over
Axilla.
here, didn't you?
No? Please
Oh,
fill
she
fill
said it
over
was
here.
one in the axle, Jeff.
The bone.
That's what I was telling you about. And you said no.
Bone.
Oh,
So-
shit, I didn't think it was.
So there's
Right
one
here.
right here.
Right
Yeah,
here.
So there's
that's
one right here
five.
then. There's five.
That's one.
At least try to fill
Good
this
job.
one.
Mr. Ralph found one in the axilla area. Good job.
We did too.
Rob,
You
can you
found one
please
over
see if
here?
you can find
One right
any in
here.
this one? We only found
One
one.
right here. So that's 6.
We only found one in
Right.
that one.
I think it
I
was.
want you all to stick with your group because you can do
Yeah,
the
that's
skills
not your
checklist.
group
We're
on
gonna
Do it together?
no, we're gonna switch models. So they
Oh.
won't know.
Okay. Okay.
Maybe
So
you
we
need
gotta
to
do
come
it
over on
ourselves.
this side.
You helped me.
I really can't find but one in this one.
It's more than one in each of those. It's
Oh.
about 8 to 10.
In each?
Not in, it might not necessarily
Oh,
be in each breast. I
okay.
can't tell you exactly where they are because you're gonna have a little quiz on this. So you
David,
have
would you
to
like
One
to
right
try
here.
to see if you can find
Take
Mrs.
time.
French, I have a question. What about,
Oh, it's
like
11
my
hard.
aunt is 90, well, will be 90.
If she
What
lives to
age?
90, if she's lived to 90,
They don't have to worry about going to have a mammogram or anything like that.
No, they don't. Really,
May we switch one?
no, you can't switch models. You have to keep the model that you have. It's very important that you keep the model that you have and find all the lumps that you have. Okay. So make sure that everybody in the group has an opportunity to find all the
Yeah,
lumps.
yeah.
Seem like the same
I
person
went by
is
nipple right there.
So we got
on,
like
on the breast. Make
Yes.
sure
we
you
got
find
one.
those lumps.
Yeah, there is.
One
You
here.
have to, if you perform your self-breast exam
1 year.
properly, you should be able to identify all the lumps that's in
Is
the
this
one
breast.
down here. It's 4.
They're very easy to find.
There's one right under the nipple.
Yeah.
Over here.
You found that one.
Five.
That's correct. That's one right there.
Oh, yes.
Can you feel it? You know what a lump
Oh,
feels
here's
like.
one right here on this breast. Right
See,
there.
they found one
Oh,
over there
yeah.
on that breast.
Mm-hmm.
Jump
There's
in
not
over
that.
shoulder.
There's only one in that.
One there.
Come around some more, John.
1 here. It's 2. 3.
And see, you have to become the most familiar with your own breast. So you'll know
the
that
circle.
sometimes you might have some lumpy tissue, you
Here.
might have some
That's
tissue
4.
that feels funny, but you know it feels like
Would
that
this be
all the
one right
time.
here?
What
So
about,
I
like,
like
It's the same
unusual.
way size.
Oh,
I think it's-
No,
what
it's
about
not.
fibroids?
Fibroids. Yeah, some people, not
Yeah, that's-
fibroids, but
that's
fibrocystic
Yeah.
breasts. Some
6.
people have cysts in their breast and they're normal. You know, but you have to be able to identify those and you want to make sure that you verify that that's exactly what it is with your healthcare provider. And that's when you go in for your annual exam and get your breast exam and your pap smear. You want to make sure that your provider performs a clinical
All of
breast
that.
exam.
Yeah, let's
That's
do-
one
let's
of
do
the
the down.
ways to early detect breast cancer.
I think she said this is.
Okay, yeah, like this.
They're like stars.
Okay.
Go
That's
out.
stars. You can go this way, and
So,
wedges
like,
they call it, and then you can go up and down, and you can do light, medium, and deep palpation to make sure you cover all the breast
Did we
area.
find this one
And you
here?
want to make sure you
Yeah.
find all the humps.
You don't have them.
Yeah, you have,
We're on here.
I did.
We got 6 so far.
Oh,
Like,
yeah, we both
5
found
in row
6.
here.
Six.
Yeah, we found 6.
That's
I believe
all.
we
You only
found
found 6.
eight.
Wait, one
about.
right here. So
You
that's
found
7.
8.
Oh, did you find one in here?
It's way down there.
Oh,
Oh,
yeah,
that's
there
seven.
it is.
All right.
Did you find one?
Yeah,
7.
way down there.
See, you gotta go deep.
Yeah.
You gotta go deep.
So you can't even. It's not just. They're not just at the edges. They're not.
And then 8 right here.
You found
found
8.
eight.
Down there.
Good.
Okay. Okay, so are you all finished practicing?
Yes, ma'am.
Yes, ma'am.
Okay, so what I'm gonna do is we're gonna start out with the checklist. And we might not finish everyone today, but whoever feels the most comfortable, we're gonna take the checklist. It's 2 pages each.
Take one and
pass
pass it
them
around. Take one, pass it
Take
around.
the checklist, pass it around. It's 2 pages.
Make sure you get it back down.
Make sure everybody has a checklist, and we're gonna see we can get through today. If we don't finish everyone today, at the next class we'll finish those who don't get an opportunity to get checked off today. Now I'm only gonna be able to check off one at a time. I can't do 2 breasts at a time. And what we're gonna do is those who practice on that model, we're gonna reverse it, and so that way you won't be the most familiar with it. Okay. All right. So you might want to look over the checklist. Don't worry about introducing yourself to the patient or anything.
Okay,
You can skip that part, and you'll start exactly with the breast exam. You want to make sure you look at it, and you want to make sure we don't have a real patient, but in a real patient, you want to make sure that you actually inspect the breast by looking at it when they're standing up. And then you want to make sure you check for any kind of retraction, any dimpling, any moles or discoloration, any discharges coming out of the nipple. Those are some of the things you want to look for if you were actually doing an exam. I know on these models we can't go through all the proper steps, but you need to make sure you know them. You also need to make sure you take the time to read the pamphlets that I gave you on breast care, and you want to make sure that you know everything in there, because we won't get to the quiz today, but we will have the quiz next week, so that'll give you time to study. All right?
Yeah.
Okay. Right. Okay, and then if you did not have the opportunity to to watch the video on Susan G. Coleman's website, you need to do that before next week. It's very important that you do that. All right, so how are we doing? We're doing okay? Okay. Nobody needs a break? Okay. All right, so he started with the checklist, and he had an opportunity to review it, and you all also will have a chance to review it. And since we're running out of time, everybody will do the checklist next week. So you take the time to go over the checklist so you'll know what your responsibilities are as far as what you'll do in the skills lab next week. Do you have any questions? What's your question, Mr. Ralph?
For practice, can we use a balloon or something like that to feel apart?
You can practice with a balloon, or you can practice with some pearls.
Pearls?
Your wife probably has pearls, or you
Yes.
can practice with different sized pearls.
Because they were kind of hard to find over 8.
Right. But just remember, it's about 8. And so just have that focus in your mind. It's 8 to 10 lumps in each breast. So thank you all for being so attentive. We're running out of time. So if you have any questions, you can ask. I'll give you a little bit of time before we start our checklist and our quiz next week to ask whatever questions you have. Mr. Ralph, we're out of time. You can ask your question next week when we have
Yes,
more
ma'am.
time. All right. Thank you.
Oh,
All right. See you all next week.